So recently, I got a few messages from some young people who had seen some of my videos. And these are young people who are thinking about getting into nursing and wondering about, is it a good idea to become a nurse? So apart from the fact that you'll end up with a job, no matter where you are in the world, nurses will have jobs because they need nurses. Um, Guaranteed income, guaranteed job. The reality of nursing is you're going to have the front row seat to the most intimate aspect of people's lives. I'll talk from personal experience. When I first became a nurse, actually, let me talk about an experience I had as a student nurse. My first experience with death um, in a professional setting. I was on my first clinical, it was a cardiac ward, and it was where I think it was people with long term cardiac conditions, chronic conditions. So one of the nurses, one of the very experienced nurses there, suddenly pulled the code blue button and she shouted where she was so people could come and help, because in the UK, people are in bays, patients are in bays, should I say. They don't have single rooms like here in the States. So if you pull the code blue button, I think if I remember correctly, there'll be a flashing light, but you also had to call out so people know where you are. So she pulled the code blue button and everyone on the unit ran to go and help. And then it was the person that the admin, the person who sat at the front desk, their job would be to call 2222, which was the code blue number, to get people to come and help from the ER and the resus team. So it was the resus number. So, the code is activated. And I didn't know I was terrified. I was like, oh my God, what am I going to do? What will be my role in that? So I went, and as I was actually the first person to arrive to help, and I didn't know what to do. And she goes, help me put her on the bed. The patient was sitting on a chair beside the bed. You know, all the beds in the UK, besides them, they have these big chairs that patients sit in during the day. So she was a very big woman. I helped the nurse. We basically heaved her onto the bed, and she looked pale and her eyes were rolling back. That was a terrifying moment. I will never forget that. And we heaved her onto the bed. She almost fell off the bed. And then the nurse started to do CPR. And slowly, well, in my mind, it felt slow. I think within a minute, other people had arrived to help. But it felt like forever to me because it was just me and the nurse and the patient. And of course, the other 5 patients in the bay looked terrified because it was 6 patients per bay. And so the nurse began doing CPR. And then she said to me, take over doing compressions so that she could do the meds. So I started doing CPR, and I'm pretty sure I didn't even have my hands on the correct spot on the chest, but I was just like, okay, I'll just do whatever I'm told to do. So I start doing that. And then the doctors arrive, the resus team arrives, and they take over. From then, I don't remember what happened. All I know is the patient did not survive that. So that was my first experience with death. So before I became a nurse, it never ever dawned on me that I would have to deal with death, because my experience with nurses as a child was you go to the doctors, the nurse gives you an injection. So I remember thinking, I guess when I'm a nurse, I'll probably give some injections, but I never ever thought about what else I'll be doing. So that was a very, very good wake up call about the realities of becoming a nurse. So if you're a young person and you're thinking, what will nursing be like? You will deal with death. And then I went to work in sexual health. My first nursing job after I qualified was in a sexual health clinic. And I intentionally chose to go and work in a clinic because I said, I don't want to work in a ward. I really did not enjoy working on the wards during my clinicals. So I thought, where can I work that is not a ward? And I found a job in a sexual health clinic. And as the name suggests, it's a sexual health clinic. You're going to learn a lot about sex. So people come and they give you their sexual history. That was part of the assessment. You ask them about their sexual history. How many sexual partners have you had? What kind of sex do you have? Um, so at this point, I'm in my very early 20s. I went to nursing school aged 19, finished nursing school aged 21, 22. So I'm about 22 years old. And I was a very naive 22-year-old. And so now my job is to ask people about their sex lives. How many sexual partners have you had? What kind of sex do you have? What kind of people do you sleep with? Do you sleep with men? Do you sleep with women? Which orifice do you prefer to use for sex? You know, et cetera, because all that informs where you're looking for infection and on the part of, as in, which part of the body do we need to test for infection? Are we testing the mouth, the rectum, vagina, penis, you know, that sort of thing. So all of a sudden you're asking people these questions. And because they're in that environment where they've come because they suspect that they might have an infection, or they're just worried, well, you know, or they're being really, really careful about their sexual health and they're getting tested so that they can show their partner that they're safe to sleep with. So all of a sudden, you're in a profession that allows you to hear about people's most intimate um, business, you know, sexual intimate business. And then after you've done the sexual history, guess whose job it is to look at their genitals and take swabs? Your job. So all of a sudden, I have my face between people's legs from 8 a.m. until 5 p.m. taking swabs. You start to recognize different infections by how they smell. So that's a reality of nursing. If you, let's say you're working in a sexual health clinic, or when I became a midwife, every single woman you're going to examine on the labor ward has to open their legs to you. And you have to examine them and check if their labor has begun and if it's progressing. So you start to recognize different smells in terms of how does it smell when someone has bacterial vaginosis. So yes, and then you become part of the joyous moments of people's lives, but also the most intimate. So a few years into nursing, well, not even a few years, I guess, after less than a year of working in sexual health, I decided I was going to go back to school and become a midwife. So I became a midwife. It took 18 months because I was already a nurse. And here I am, still really young in my 20s, and I am present when people are born. And also, you're the one whose hands are there assisting that mother with delivering their baby. So I have distinct memories of how it felt to hold the baby's head and guide the baby out of the birth canal. I have distinct memories of how it felt for my gloved fingers to slip between the baby's arm and chest, and sort of slip my fingers into their armpits to guide the baby out of the birth canal. So all these are very intimate moments that you get to experience depending on where you're working as a nurse. And obviously, if you're a midwife, you have to put your fingers inside the birth canal to assess if um, the mother is progressing. And then comes the sadder moments where you are giving end of life care. It starts from when the family is first told that, you know, we've done everything that we can, but we've got to a point where nothing we do is going to make your mother or your father or your brother or your sister better. At this point, they have become so ill that their illness will lead to death within a week or a few days or however long it is that the doctors predict. And yes, I know a lot of people will say only God can predict when a person will die. Um, and I guess I can understand when people say that. But I guess when doctors are speaking about how long a person is likely to survive in those instances, it's based on figures. We're looking at their labs. Their labs are telling us this pH is not compatible with life. These electrolytes, which we cannot fix anymore because they're not strong enough for dialysis, not compatible, various things. We're looking at various things, even how, okay, maybe the heart is not functioning well anymore, or whatever it is that's going on has gotten so bad that nothing can be done to help. So it starts from that moment where the family is told, and they are now having to make that really difficult decision to say, if this person's heart stopped beating, we're okay with you not attempting CPR. So changing the code status, where the family is being asked or advised or being given the option, I don't know what to call it, to change the code status from a full code to a do not resuscitate. That's a very difficult thing for people to experience. And as a nurse, you're there because you're the one at the bedside. And you can hear families discussing amongst themselves what's the right thing to do. Should we or shouldn't we? Should we let God decide? Or should we make that decision because the doctors say it means less suffering? You know, you are in there experiencing this thing with the family. It may not affect you the way it affects the family because it's their experience, but you're a part of it. And how you look after them in that moment affects how they're going to remember that experience for the rest of their lives. You may say something without even recognizing that to them it felt insensitive. Or you might even say something that helps them along that journey of making that very difficult decision. And then after the decision is made, and maybe the family says, let's withdraw care, you are now that person who is with them as their loved one dies. And you are giving end of life care, which means you're basically trying to make sure that this person dies without pain, without anxiety, without discomfort. You are doing whatever you can to keep them comfortable until they take their last breath. And it's strange, but I guess also not strange because you feel energies in those moments where you are giving end of life care. You feel different types of energy. I feel if someone is at peace, they go very peacefully, and you feel that peaceful transition that that person has. And someone's not at peace, you also feel that energy where they've gone, but maybe are still struggling with something. And then there's also something about watching people take their last breath. It's such a private and intimate moment. And I think about it sometimes and think, oh my God, I have watched several people take their last breath. That is not something that we all get to experience. But as a nurse, you're probably going to experience it at least once, depending on where you work. And there's something about watching someone take that last breath. And I don't know what it is, but it looks as if it's intentional, as if the person makes the decision that, okay, I'm done. I'm done. This is it. And they just take that last breath and gasp and go. So there you are again in the most intimate and final moment of someone's life. So if I was to say to someone, what's nursing about? It gives you a front row seat to other people's most intimate moments in life from the moment a person is born up until they die. In between birth and death, you are watching a person struggle with their illness. You're watching them find strength or give up. Um, you know, that there's moments when there's no family members around. It's just you and that patient in that room. Maybe you've come to give medication. Maybe they're telling you they're in pain. Whatever it is that's going on, you're there and you are watching them experience something that's very personal to them. It's their pain, it's their illness, it's their experience, and you are right there watching it. And you have the privilege or opportunity, whatever you want to call it, to help with that, to help them feel better in any way that you can. And what I've found with time is as you grow yourself, because I think when I was younger, I really struggled with what's the right thing to say when someone's experiencing something really, really difficult when they're ill. What is the right thing to say? Because as humans, we always feel like we need to say something or do something. But as you get older, you recognize that sometimes there isn't something to say. Sometimes it's just your presence and how you interact with that person, and just offering to be of assistance and saying, hey, this is what's going on today. I'm giving you this medication. This medication does this, it does that. Are you okay with taking this medicine? If not, I hope you understand that you may experience that or that or that. And then offering things that give comfort. Would you like to have a bath? Is this a good time for you to have a bath? Do you need the bathroom? How are you feeling today? Did you sleep well? Are you comfortable in your bed? Can I turn you? Would you like to watch TV? What would you like to watch on TV? Or sometimes, if it feels right, if the energy between you and a patient feels right, you can just ask and say, oh, so do you have any family? You know, um, was that your sister? Or, I mean, that's not always a good idea though, because I once asked someone if um, the person visiting was her sister, and it turns out it was her wife. So maybe ask something like, oh, how are you related to that person? So that you don't embarrass yourself or potentially the patient. But what I'm trying to get at is, as you mature in the profession, you start to know what is right to say and what is not right to say, or how to behave or how not to behave. It becomes easier. You become more comfortable in yourself around patients, and you stop thinking too much about how do I deal with this really difficult thing that this person is experiencing, because you have a natural instinct to want to help. You want to help so badly, because it's your job, isn't it? You're the nurse. It's your job to help. It's your job to be there for them. So you're thinking, how do I solve this? You're looking at it as a problem and you're thinking, how do I solve this? How do I fix this? You want to fix everything. So that's nursing in a nutshell. Good, bad, everything, everything in between. So if you are thinking about nursing, those are some of the realities. And that's not to put you off, but to give you a realistic view of what you may experience when you become a nurse. Because I know I didn't have a realistic view. I just thought I'd be giving injections. Yeah.